Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Walt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to have as our guest Tim Cernohous, Senior Vice President and President of Community Retail and Long-Term Care at Cencora. Tim, great to have you with us.
Good to see you, Jeff, and thanks for having me.
Recently you announced a $5-year billion-dollar project to invest further in your pharmaceutical distribution network. Can you tell us about that program and what's involved?
So going back to the investment that you just highlighted, $1 billion, 5 years, really comes from two primary driving factors for us at Cencora is growing demand that we see across the industry spectrum, really in all classes of trade and all pharmacy providers. And then the second, the need for cold storage. We continue to see cold storage needs growing for our customer bases, primarily in specialty. And so really this investment is a years-long effort in terms of watching market dynamics and being able to respond to that and making sure that we're adequately prepared to meet the needs of our customers.
Tim, you mentioned cold chain capabilities. Why is that so important in today and going forward?
We're really watching market trends that help us to really make sure that our supply chain and supply chain capabilities are equipped to meet the needs of both today and into the future. And so as we look back at just kind of some of the most recent years, in 2017, about 26% of the overall pharma channel utilized cold chain capabilities. That today is around 36% total. So you can see that dramatic growth in what overall kind of the needs of our customers and the needs of where pharma is going. But if we look prospectively and we look out, really 70% from what we see out of IQVIA data is 70% of all new products that are in development have some element of cold chain, whether they be cold chain, frozen chain capabilities. And so when we think about where is the industry going over the next 5 years, again, increasingly they need cold chain, and they're going to continue to need cold chain capabilities into the future. And I think as many of our listeners would identify, that poses a challenge. That poses a challenge for pharmacy operators. It also creates challenges for us as distributors as well. When we just really think about capacity as well as being able to do the preparation of those cold chain shipments, being able to have that space and be able to accommodate larger packages in many cases is really important. So it's really the totality of that number one is driving some of our needs. The other thing that I would just want to kind of pull back is as we think about efficiency within the network as well, Jeff, it's really important that, and especially in cold chain, but kind of overall, and as we think of the investment, how we can have that product as close to the customers as possible. And so we do that through our forward DCs. And so we have over 26 DCs across the country where we're able to get to the final mile of our customers very quickly, very efficiently. It's also important, though, that as we think about how do we bring product into that network, that we do that as efficiently as possible. We believe that's part of our good stewardship as a company. And so how can we efficiently bring product in? We know that by using a national distribution center that we can bring product in more efficiently, more cost effectively for our manufacturer partners into one facility, how we can then move that product back out into the channel, back out to our customers. And so, it's really the combination of those things together that are driving some of our innovation, the need for space, increased capacity, and then also just overall efficiency. One other thing that I would like to share, though, Jeff, that is really important is that, again, cold chain is not just happening inside of our specialty DCs, inside of our new national distribution center. We're also expanding our capabilities across our network. And so we're having expansions happen in 12 of our additional facilities. So when we think about the needs of community pharmacy, super important in terms of how are we supporting them increasingly in that final mile and being able to have product and capabilities to be able to meet their patient care needs both now and into the future.
You mentioned community pharmacies. Do they need to make a corresponding investment in cold chain on their end in the stores to be able to dispense these products properly?
I think every pharmacy is slightly different in terms of what their configuration is and who their patient population is. And so, as I kind of think about and talk to pharmacy customers, it would be prudent for them to continue to evaluate their cold chain capabilities. Not only how much capacity they have, but also just making sure that they have robust refrigeration processes, temperature monitoring. That's a big patient safety thing. So we're always thinking, and as a prior operator, always thinking about patient safety in that. We're also thinking about how do we continue to evolve our offerings and our support of independence and really the community at large. And so, we want to have conversations with our customers around how are they thinking about cold chain and how can we support them to have access to the medication that they need at the right time, and also thinking about how they manage their inventory. So that's something that we're really digging into, and we're hoping to be able to talk more to our customers and to the market in the future.
Tim, going back to the billion-dollar investment, a new distribution center is under construction, a national distribution center. You also, I understand, plan to use more robotics and AI. Maybe you can talk a little bit about those things.
Right now, Jeff, we already have a large forward DC network that I shared before a little bit on. So we also leverage what we'll sometimes describe as an NDC, but a national distribution center. So we currently have one. And part of this investment is for us to be able to establish a second national distribution center to be able to service our customers. So that new facility really has a broad range of impacts and capabilities that we're looking to bring. And so you talked about robotics and automation, but I would really start first to say that it allows us to have flexibility in our model by having two national distribution centers. And how do we think about resiliency within our network? And so those two distribution centers are not located in the same physically in the same city. They are separated intentionally by some distance in order to be able to help support that resiliency of our network. Because overall, we all know it that our supply chain is critical. Pharmaceutical supply chain is critical in the U.S. And so we really want to make sure that we're as resilient as possible to make sure that we're ready for whether it be a natural disaster or the like. Hopefully that never comes, but we want to be prepared for that. In this new facility, though, really we are thinking about how to be as efficient as possible. And so that does go from the use of robotics where it's appropriate to be able to help really on some of those highly repetitive tasks, how we can have that technology also work alongside our team to really make our team as efficient as possible and allow them to do value add work. So there's things such as autonomous robots that will be in there, packaging arms that will help us package pallets and really allow us to get that product, receive it in, make sure we can get it packaged and get it out to our forward DC. So ultimately it can be activated and used by our customers as quickly as possible. And so then you also talked about the use of AI. And while we see application for AI and we're using that in a variety of different modalities, one of the things, though, that we're just using is really data and understanding what our manufacturer partners, how are they producing product, how are they bringing product into us, and then the needs of our network. And so where we are using and leveraging data is to make sure that we get that product in and we get it routed to the right forward DCs and to the right customer bases as quickly as possible. And so we use technology such as, it's called the ASN, or the Advanced Shipment Notification, that allows us to understand when packages are inbound, when are they going to receive us, and then ultimately, how can we route them throughout our network as efficiently as possible. And so that's a place where, yes, both AI, but then also just our overall supply chain management system allows us to really efficiently move that product and minimize any sort of delay that would prevent a customer from then being able to get the product that they need.
Let me shift gears and ask you about a couple other things.
Yeah.
Drug Supply Chain Security Act implementation continues, and we have a deadline coming up soon. Maybe you could talk to us about how the process has gone so far and what issues still need to be overcome.
Yeah. So DSCSA, as we refer to, and Drug Supply Chain Security Act has been in the works for over a decade. And, us at Cencora, we've been working on that over that same period of time, really thinking about the equipment that we need inside of our distribution centers, making sure that we have the right subject matter expertise. We're partnering with manufacturers and we're providing education to customers. And so we've been on this journey for a decade plus, and as a distributor, and distributors are all live at this point in time with DSCSA, we continue to be prepared to meet the needs of our customers. And so in 2025, we see the large dispensers going live, and then in 26, we'll see the small dispensers go live and make sure that they have to scan and receive product accurately into their system. For us, a big part of what that has meant is how do we have the technology to be able to allow product to efficiently move through the system, minimizing any sort of exception handling that we need to be able to have. So that's installing, in many cases, high-speed cameras that can allow us to be able to capture the DSCSA requirements as it moves throughout our network. But beyond that, there's a lot that pharmacy customers have had to be able to do with being able to set up their GLNs and be prepared for this. And so we continue to work with industry partners really across the spectrum to have our customers be ready. And that's something over this next year we're really going to be able to continue to focus on, so all of the small dispensers are ready as well. I also want to take a minute, though, Jeff, and talk a little bit about WEEs, which are the waiver and exception, the exception and exemption process. Is that we believe that you should use WEEs in the most appropriate way possible. And in many cases, we've also secured WEEs. Now, we've done that not because we aren't ready, we as Cencora, but really we know that there are several manufacturers that are still struggling to be prepared. And so what we want to make sure is that we have patient access is really at the kind of the forefront of our mentality and our work. And so we don't want to be holding up any product within the supply chain and creating a shortage as a result of not being able to meet all of the DSCSA requirements. So we have asked for WEE exemptions in certain cases because of the manufacturers, and really wanting to make sure, and our manufacturer partners have been tremendous. We just want to make sure that we can keep that product moving throughout the system, ultimately being able to support patient care, because that's our first and foremost concern.
In addition to your investment in your own distribution network, you guys also do a lot to support community pharmacies, particularly your own Good Neighbor pharmacies. Maybe you could tell us what these people need to do to cope with the cost pressures they face in today's healthcare system.
The challenges that are facing community pharmacy are very real, and we continue to work every day as a pharmacy enablement provider to really make sure that our pharmacies have the operational support to be able to run very successful businesses, provide direct patient care in the way that their patients and their communities need, and that they're also prepared to look forward to the future, and that they can have sustainable practices going forward. And so for us, that shows up in a variety of different ways. Is really within Good Neighbor Pharmacy, we provide business coaching support to our customers that really thinks about, really it kind of covers the gamut, if you will, from the back of store to how are they running their pharmacies. So that could be how are they staffing their pharmacies, how are they handling prescription adjudication and really some of the business service activities, to how are their front of stores working and how are they making sure they're meeting the needs of patients. So we're doing that. One of the things that we overlay on top of that is really our advocacy efforts. And I know that I've interacted with you, and I have many great colleagues at APHA, NCPA, NACDS, where we're all very active on the advocacy front, both on making sure that pharmacies are being paid fairly for the medication and the work that they're doing, and also for clinical services. And I'm really excited about some of the advocacy work that's happened this past year in concert with many of those partners that I just mentioned, as well as our customers, to make sure that we can obtain the appropriate recognition for the clinical work that pharmacies do. I think that's an area of huge opportunity. I'm very optimistic about what will also happen here, hopefully in calendar year 25 and that in 26, because we want to be able to see pharmacies have that diversified opportunity to be able to support their patients, both from product replenishment and product dispensing to clinical services, and really the pharmacy navigation and health navigation support that they need to provide and that their communities need them to provide over the long term.
Thanks so much for sharing your insights with us today. I really appreciate it.